In this presentation, we will discuss the health crisis of the abnormally high rate of maternal mortality in Sierra Leone. Sierra Leone is a country located on the coast of West Africa with an area of approximately 71,100 kilometers squared. According to World Populations Review in 2022, it is currently home to around 8.4 million people, and this is based on the projections of the latest United Nations data. Although the population net increase in Sierra Leone is one birth in every 10 minutes, the maternal mortality rate is alarmingly high. According to an article titled Where Pregnancy is a Deadly Gamble by Daniel Pickett, posted by the Washington Post, Sierra Leone is one of the most dangerous places to give birth, with 1 of 20 women dying as a result of giving birth in pregnancy. Although nearly all of these deaths are preventable, the health system was mostly decimated by a decade of civil conflict before one of the worst Ebola pandemics in history killed nearly 7% of medical personnel as well as the economy. Survival during birth is often left to the luck of having a nurse or physician nearby who won't illegally charge the patient or that the government is paying them, and luck that there's enough blood in the blood bank. Health staff are reportedly in short supply in Sierra Leone, and blood supplies are frequently unreliable. Abortion is prohibited, however, routinely done, without a doctor's approval. The article goes into detail on the story of a pregnant 17-year-old girl named Susan Levy who fears of repeating her mother's story of dying while giving birth. Her story was documented through various interviews over a long period of time and shows the experiences of what many women face in Sierra Leone and gives insight on why the maternal mortality rate in the country is as high as it is. Susan's mother had lost too much blood and passed away the day she was born, and her father wasn't present, which led to her grandmother having to adopt her at birth but ended up dying when Susan was 9. At 16, she was hospitalized because of a cyst on her ovaries, with the nurses notifying her that she would never be able to be pregnant. During this time, she was homeless until a man in his 60s offered to pay for her school if she stayed with him. Susan dreamed of graduating and taking care of herself, so she agreed. But months later, this man passed away, leaving Susan with nothing but a surprise pregnancy. She was homeless and pregnant at 16 and without any money, but she got lucky when she met a nurse named Amy. Nurse Amy was known for helping the sick and took Susan to all her doctor's appointments where she found out she was in need of a C-section. Amy encouraged Susan to check into the hospital early, unsure of the exact due date, but she was scared because blood banks often don't have the right amount or type of blood. Fortunately, Susan's C-section had gone flawlessly and she had given birth to a baby boy. This wasn't easy for her. She was always in fear, and traveling to the hospital took hours and was tiring, especially closer to her due date. Susan was considered lucky to have Nurse Amy and the courage to go to the hospitals, which is often not favored by the women in Sierra Leone. Although Susan's story is unique, her experiences of giving birth is much like the other girls living in the same conditions or worse in Sierra Leone.
One of the highest rates of maternal mortality is seen in Sierra Leone. Many pregnant women still lack the access to health care despite it being free, and many women still give birth without medical assistance since there are no trained medical professionals available. The location of the hospital, the availability of transportation, and the position of women in society are all factors that influence their birthing decisions. A qualitative study of statistics from the article Distance, Accessibility, and Cost, Decision Making During Childbirth in Rural Sierra Leone, a qualitative study, Tracy A. et al., 2018, interviewed newly pregnant women and members of their communities. They participated in group discussions and individual assessments. 2 rural communities were included in the qualitative research on decision making during delivery in Sierra Leone. Residents of both settlements only went to Musanga Hospital for a majority of their stay. The first community to Musanga Hospital was only accessible on foot, took about half an hour, and required the patient to wade across 3 rivers. From the second settlement, there was only one road, and the only way to get there was on by foot or by motorcycle. Usually, when a car drives down this path, the vehicle will break down along the way. So when pregnant women are exposed to many vulnerabilities at once, it may have a negative effect on whether or not they seek medical treatment in Sierra Leone.
For our second peer-reviewed article, we took a look at Joan's article titled Women and Babies Are Dying, but Not of Ebola, which analyzes maternal health services during the Ebola epidemic in 2016, comparing statistics from prior to and post-epidemic. The Ebola epidemic has great effect on maternal health care in Sierra Leone. The article takes a look at statistics regarding increased maternal deaths and stillborns prior to and during the Ebola virus epidemic. It also discusses the unavailability of emergency obstetric care in Sierra Leone. The leading cause of maternal deaths are obstetric hemorrhages, which involves extensive bleeding and the failure to cease the bleeding and save the individual. The article mentions how these deaths occur in environments that are not plentiful in resources. During the time of the epidemic, lack of resources was a prime concern and continues to be relevant, along with decreased emergency care services. The conclusion of the article entails that health services in Sierra Leone require improvement in order to provide higher quality care, especially during potential future epidemics, which will allow for lower maternal death ratio.
I will be talking about the philosophical approach in relation to our article. The journalist Charlotte Paquette is using a phenomenological approach. The journalist presents the issue through Susan Levy, a 17-year-old girl. She shares her experience about the life of being pregnant in Sierra Leone and raising her children. This type of framework enhances the discussion as this shows her personal experience issue of how pregnancy is handled in West Africa. Using another framework, such as social justice, could assist in the understanding of the issue for people in other countries, including advocacy, will move towards finding support and solutions to decrease the number of maternal deaths. Using only one approach to present the issue limits the discussion as there is a need for advocacy to aid the ongoing issue.
It is important to regard the culture of the people that we want to care for. Learning allows us to have the ability to provide culturally competent care to people of diverse backgrounds. The culture of Sierra Leone's high mortality rate has to do with poverty. Poverty is caused by a number of sociocultural factors, especially regarding the fact that abortion and contraceptives are looked down in Sierra Leone, both culturally and legally. People in poverty often repeat the cycle of poverty because it is all that they know. People who live in rural and less wealthy areas tend to have the highest mortality rate, especially because they lack the adequate access to the health care needed to have a safe pregnancy as well as childbirth. It is alarming that 1 in 20 women die in Sierra Leone from pregnancy. The use of maternal services that are provided are mainly beneficial to those who have a higher socioeconomic status. This is a subgroup that only takes up less than half of Sierra Leone's population as a whole. This information goes to show that there are also social inequities that play a part in this health disparity. However, through organizations and programs targeted at decreasing the poverty in Sierra Leone and increasing the education levels, there should also be policies for people of a lower socioeconomic status to also have that equal maternal service. This also ties in with our next topic of suggestions for potential nursing implications.
So, what are some possible nursing implications? In 2010, traditional birth attendance, also known as TBA, was banned in Sierra Leone because of the high maternal mortality rate, and giving birth in medical settings and clinics was encouraged because, in the event of difficulties, skilled medical personnel could offer assistance. However, many women still chose to give birth at home with a TBA because they feel uncomfortable in medical facilities. It is important to use phenomenology to ask why these women are feeling uncomfortable in medical clinics when they should feel safe and taken care of, and what a nurse is doing to contribute to this, and how can they overcome it. Nurses in Sierra Leone understand that a majority of the pregnant women in the country are in fear of giving birth because of what they've experienced or have seen other women experience. It is important to work to make a more comfortable setting for these mothers and to encourage them to give birth at actual medical clinics instead of at home. Looking back to the Washington Post article, the true impact of the nurse named Amy is seen through her relationship with the young pregnant girl named Susan. Unlike Amy, the nurses failing to educate these women with the risks of at-home births can be a possible clinical consequence to the high maternal mortality rate. Failing to make the patients feel comfortable in medical settings is also another nursing implication. Amy made sure Susan went to all her appointments where she found out she was in need of a C-section. Susan had thought C-sections were dangerous because of her experiences. However, Amy educated her and ensured Susan that she had nothing to fear. Also, many communities in Sierra Leone negatively view the idea of contraception, thinking that it will render women sterile and is a sort of abortion. Because of this ideology, many women become pregnant at young ages, unplanned. According to Dr. Obiodun from the UNFPA Sierra Leone, over half of all maternal deaths in the country occur in girls and teenagers under the age of 19. Nurses in Sierra Leone are educated and know that contraceptives are for safe sex and not a form of abortion. Nurses should educate this to young girls who've been taught otherwise. For example, the CARE Sexual and Reproductive Health Program is present in around 30% of communities in Sierra Leone. A 15-year-old girl had stayed for one of their meetings and learned that she had previously been misinformed about contraception and changed her mind about it. Nurses in Sierra Leone can not only teach but promote these types of programs, educating young girls about the truths of contraception nutrition, minimizing unplanned and teen pregnancy, ultimately lessening the maternal mortality rate.